Hello friends, welcome to my YouTube channel, Gajpal A Learnings. In this video we are going to study about prescription, which is a part of Pharmaceutics Part 1 of B Pharmacy first semester. Topics covered in this video are definition of prescription, parts of prescription, handling of prescription, and errors in prescription. So let's start. First let's see what is prescription. In pharmaceutics, a prescription refers to a written or electronic order from a licensed healthcare professional, typically a medical doctor, dentist, or other qualified prescriber, instructing a pharmacist to dispense a specific medication or treatment to a patient. Prescriptions are an essential part of the healthcare system, as they ensure that patients receive the appropriate medications and dosages tailored to their individual needs. Now, parts of prescription. A prescription consists of several essential parts to ensure accurate dispensing and safe use of medications. These parts include: first, patient information. This section includes the patient's full name, age, gender, weight, if relevant, and sometimes additional identifying information like address or date of birth. This ensures that the medication is intended for the correct patient. Second, date. The date when the prescription is written. It helps in tracking the currency of the prescription and ensures that it is used within a reasonable time frame. Third, superscription heading. This part usually starts with the symbol RX, which stands for prescription. It indicates that the document is a prescription order. Fourth, inscription or body. This is the central part of the prescription where the specific details of the medication are provided. It includes A. Medication name, the generic or brand name of the prescribed drug. B. Dosage strength, the amount of the active ingredient in each dose. C. Dosage form, the physical form of the medication, example, tablet, capsule, syrup. D. Route of administration, how the medication should be taken, example, orally, topically, intravenously. E. Quantity, the total amount of medication to be dispensed, often written in both numeric and word form. F. Directions for use, instructions on how the medication should be taken, including the frequency and timing of doses. Now fifth, subscription or dispense is written, DAW. This section indicates whether the prescription allows substitution with a generic equivalent or if the prescriber specifically requests the brand name product, dispense is written. Sixth, signature, the prescriber's signature, confirming that they have authorized the prescription. Seventh, prescriber information. This section includes the prescriber's name, professional title, contact information, and sometimes their registration or license number. Eighth, refills, the number of times the prescription can be refilled, if applicable. Some prescriptions may have PRN written, indicating that the medication can be taken as needed. It's essential for prescribers to write legibly and accurately, and for pharmacists to verify the information before dispensing the medication to ensure patient safety and proper medication use. Patients should also be aware of the prescription's instructions and ask their healthcare provider or pharmacist for any clarification if needed. Now, handling of prescription. Handling prescriptions involves a series of important steps to ensure patient safety, accuracy, and compliance with legal and ethical standards. Here's an overview of how prescriptions are typically handled. First, prescription issuance. The process starts with a qualified healthcare professional, such as a medical doctor, dentist, or other prescriber, evaluating the patient's condition and determining the appropriate medication and dosage. They write a prescription with all the necessary details, including the patient's information, medication name, dosage, and instructions. Second, prescription presentation. The patient presents the prescription to a licensed pharmacist at a pharmacy or healthcare facility. In some cases, prescriptions can be electronically transmitted from the prescriber's office to the pharmacy. Third, verification. The pharmacist carefully examines the prescription to ensure its authenticity and legitimacy. They check for any potential errors, drug interactions, or contraindications based on the patient's medical history and current medications. Fourth, medication dispensing. Once the prescription is verified, the pharmacist dispenses the prescribed medication. They select the appropriate medication, calculate the quantity needed based on the prescribed dosage and duration, and package it securely. Fifth, counseling. Pharmacists or pharmacy staff provide counseling to the patient on how to take the medication correctly. This includes information on dosage, timing, potential side effects, interactions with other drugs or food, storage instructions, and any special considerations. Sixth, patient education. Pharmacists may also take the opportunity to educate patients about the importance of medication adherence, potential warning signs of adverse reactions, and the significance of completing the full course of treatment. Seventh, record keeping. Both the pharmacy and the prescriber maintain detailed records of the prescription. This helps in tracking patient medication history, monitoring for potential issues, and facilitating future medical care. Eighth, privacy and confidentiality. Prescriptions contain sensitive patient information, so maintaining strict privacy and confidentiality is crucial. Healthcare professionals must adhere to relevant laws and regulations to protect patient data. Ninth, refills. If the prescription allows for refills, patients can return to the pharmacy for subsequent supplies. The pharmacist will check if the prescription is still valid and, if appropriate, dispense the medication accordingly. 10th, disposal. Patients should safely dispose of any unused or expired medications, following proper guidelines provided by pharmacists or local authorities. It's essential for both healthcare professionals and patients to be proactive in the prescription handling process to ensure that medications are used safely and effectively. Proper communication between prescribers, pharmacists, and patients helps prevent medication errors and enhances patient outcomes. Now the last, errors in prescription. Prescription errors are mistakes or discrepancies that occur during the process of prescribing medication, which can lead to potential harm to patients. These errors can happen at various stages, including during the prescribing, transcribing, dispensing, and administration of medications. Some common types of prescription errors include: first, incorrect dosage. Prescribing the wrong dose of medication, either too high or too low, can result in inadequate treatment or potential toxicity. Second, wrong medication. The prescriber may write the incorrect medication name, leading to the patient receiving the wrong drug. Third, illegible handwriting. Poorly written prescriptions may be misinterpreted by pharmacists, leading to dispensing errors. Fourth, drug interactions. Failure to consider potential interactions between prescribed medications and other drugs the patient is taking can result in adverse effects. Fifth, allergy or contraindication ignorance. Prescribing a medication to which the patient is allergic or which is contraindicated based on their medical history can be harmful. Sixth, unclear directions. Ambiguous or confusing instructions on how to take the medication can lead to dosing errors. Seventh, incomplete prescription. Missing critical information on the prescription, such as the patient's name, drug name, or dosage, can cause confusion during dispensing. Eighth, look-alike, sound-alike medications. Medications with similar names or appearances can be easily confused, leading to the wrong drug being dispensed. Ninth, decimal and zero errors. Misplacing decimal points or failing to include leading zeros can result in significant dosage errors. 10th, prescribing for the wrong patient. Sometimes, prescriptions may get mixed up, and the medication intended for one patient is given to another. 11th, duplicate prescriptions. Prescribing the same medication multiple times without clear instructions on how to coordinate them can lead to overuse or accidental overdose. 12th, incorrect route of administration. Prescribing a medication for the wrong route of administration can lead to ineffective treatment or adverse effects. To reduce prescription errors, healthcare professionals, including prescribers and pharmacists, can implement various strategies, such as electronic prescribing systems, double-checking orders, using standardized prescription formats, and improving communication between the healthcare team and the patient. Patients can also play an active role in their healthcare by providing accurate medical histories, updating their healthcare providers about current medications, and asking questions if they have any doubts about their prescriptions. Thanks for watching this video.